welcome to Nitin's RN training. Today we are going to discuss you regarding the most important topic, that is hyperkalemia. So what is hyperkalemia? Hyperkalemia. You always want to remember, you want to split this word into two like this. Hyper means something is increased. Kalemia, K for potassium in chemistry. Okay, so what is increased in this? It is what? Increased potassium level in the body. As you know that the normal potassium level is, potassium normal is always 3.5 to 5.5 MEq per liter. It is as per Enclich's RN. Okay, so what will happen if potassium is highly elevated in the body? That is the thing we are going to discuss now. Okay, so the most important symptoms you can see. Symptoms. To remember a code, murder. Murder is a code to remember the clinical manifestation of hyperkalemia. So what is murder? M for muscle cramps. Muscle cramps. U for urinary abnormalities. Abnormalities. R for respiratory distress. Respiratory distress. D for decreased cardiac contractility. Decreased cardiac contractility. And E for ECG changes. What ECG changes you can see? One is, you want to remember, widened QRS complex. Widened QRS complex in ECG and tall T waves. You want to remember that something is increased here. So in ECG also something increased, width increased and the length increased, something is increased. You want to remember like that. Widened QRS complex and tall T waves. And at last, R for reflexes. That means decreased deep tendon reflexes. It is one kind of neuro reflex. You can see that the deep tendon reflexes will be decreased. So you know that once the potassium is very high, there is a chance for muscle cramps because the muscles become very weak. And second thing, urinary abnormalities. You can see that polyuria in this case, because our kidney will try to excrete the excessive potassium from the body. So you can see polyuria in this case. And third thing, respiratory distress. Why? Because you know, once the potassium is very high, the muscles in our body become very weak, especially respiratory muscle, cardiac muscles and all. So the respiratory muscle weakness can lead to respiratory distress. And decreased cardiac contractility means the pumping will be decreased because the cardiac muscle will also be weak because of increased potassium level. And ECG shows widened QRS complex and tall T waves. And deep tendon reflex will be decreased. So these are the clinical manifestations of what? Hyperkalemia. So what are the management for hyperkalemia? Main thing is you want to use the drugs such as LASIX to excrete the potassium. So once the urination is high, the potassium level will be decreased. That is the thing. Through the urine we can excrete the potassium level. Second thing, you can give what? Nebulization. Salbutamol nebulization. Salbutamol nebulization. Why we are giving salbutamol nebulization? You want to think this is intracellular site and this is extracellular site. Normally intracellular site and extracellular side, the potassium will be almost equally distributed. So if any abnormalities happens in the body, the potassium from the intracellular side will come outside like this. As soon as the potassium comes outside, the hydrogen from the extracellular side will go inside. So what is high here? The potassium in the extracellular side is high. This is we call as hyperkalemia. So once you administer salbutamol nebulization, the salbutamol nebulization is having the capacity to shift the excessive potassium from the extracellular side to intracellular side. It will shift the potassium from extracellular side to intracellular side. So every potassium which goes inside the cells, not every potassium, whichever potassium comes outside from intracellular side will go inside, and the potassium and hydrogen become normal in intracellular side and extracellular side. That is happening in salbutamol nebulization. And last one, insulin administration, insulin plus dextrose. Insulin also work as same like this. Once you give insulin, the excessive potassium from the extracellular side will be shifted into intracellular side. And why we are giving dextrose? So as to prevent hypoglycemia. So that is all about hyperkalemia. See you all with another video. Thank you.